Welcome to Around the Couch. I'm Alec, sitting in for Jeff Callis from Kidney Couch. This episode deals with chronic kidney disease, or CKD for short. Jeff shares his history with CKD, how he learned he had it, and how it changed his diet, exercise, and life in general. After having my right kidney removed for a cancerous mass, I was diagnosed with stage 3 chronic kidney disease. Additional pathology testing for the kidney that was removed indicated my kidney had been damaged from hypertension. I had no idea. All my lab values leading up to removal of one of my kidneys were normal. The pathology results showed some arterial sclerosis, a type of vascular disease where the blood vessels carrying oxygen away from the heart become damaged from factors such as high cholesterol, high blood pressure, diabetes, and certain genetic influences. Pathology also found glomerulosclerosis, scarring in the tiny blood vessels in the kidneys called the glomeruli. These are the tiny units in the kidneys that filter urine from the blood. That was likely an after effect of prior mild hypertension. I talked with my primary care physician, and he referred me to a nephrologist. A nephrologist is a specialist in dealing with kidneys and the renal system. If you have been diagnosed with chronic kidney disease, at some point you should meet with a nephrologist to review your case. They may recommend you be followed closely by them for a period of time or for the rest of your life if needed. Sometimes all that involves is being seen by the nephrologist every couple of years or so to review your kidney function. In my case, the goal is to work with the nephrologist to do everything that I can to keep my remaining kidney healthy while also preventing kidney stones. A month before I had my nephrectomy, my eGFR score was 78, well above the normal value of 60 for a person my age and health. My eGFR score dropped to 54 right after the surgery, sending signals that there could be an issue with my remaining kidney. Now, granted, one lab value alone is not something for the physician to act on, but tells them it needs a closer look. I had lab tests for several months, confirming the pathology diagnosis of CKD. The results ranged from a low of 45 to a high of 54. Medical experts tell us you need 3 consecutive eGFR lab results below the normal range of 60 to be diagnosed with chronic kidney disease. In my case, my eGFR value was trending up and is now holding steady over the past 2.5 years. Like many other patients with one kidney, the remaining is asked to pick up the pace when filtering your blood through the kidney. Some experts tell us one kidney can function at 70% of what 2 kidneys were filtering. That's true in my case. There is debate in the medical field whether the normal value for eGFR is 60 for a person with one kidney. Your eGFR reduces with age as well. Some say if the normal value for 2 kidneys is 60, then if you are down to 1 kidney, the normal value should be 30. I'll let others debate that. I know that in my case, based on pathological results, my lab values over time, and discussions with my primary care physician and nephrologist that I have chronic kidney disease. The good news for me is that the average of eGFR values have leveled off and are holding. That is what is most important. My kidney should function fine if it stays within the range of 46 to 54. I found it helpful to chart my eGFR results over time. This is usually available in your patient portal, or you can do what I did and customize a chart with notations. For a visual person, the chart spoke volumes regarding the health of my remaining kidney. It is also positive reinforcement to see the trend line go up and hold steady. It gives me more incentive to keep up with a healthy diet and exercise. Prior to seeing the nephrologist, I had never heard of the blood test cystatin C. This is a test that also evaluates kidney function. Some experts say it's a more accurate test than eGFR because it considers other factors like muscle mass that increase your creatinine levels. She suggested that I be tested for both values going forward. 2 markers are better than 1 when tracking test results. Sounded like a good plan to me going forward. Another advantage of seeing a specialist when needed. My nephrologist felt that I was a low risk of further chronic kidney disease progression because I did not have significant protein in the urine, and I was not currently experiencing hypertension. She told me that the likelihood of further loss of kidney function is low if I take the following steps. 1. Limit salt. 2. Increase fruits and vegetables, main staple of my diet, 3 to 5 servings per day. 3. Get 2 to 3 servings per day of calcium-rich foods. 4. Maintain 72 ounces of water per day, adding Crystal Light if I would like, drink water with lemon juice or orange juice, etc. Water alone can get rather boring. My nephrologist summed up my current kidney status as, "You've been given a warning, not a speeding ticket. Make changes to your diet and exercise and your kidney should be fine. Because your eGFR is not continuing to drop, your outlook for maintaining the current levels is good." It gave me the will and determination to maintain a healthy diet, Exercise regularly and stay very hydrated by drinking 64 to 68 ounces of water, Crystal Light, etc. daily for good kidney health. I'm Alec, sitting in for Jeff Callis from Kidney Couch. Thank you for listening. Join us next time around the couch.